Title: Michigan's Medicaid Renewal. Are you keeping up with the paperwork? TLDR. The Michigan Department of Health and Human Services, MDHHS, is implementing new measures to preserve Medicaid eligibility as the renewal process resumes following COVID-19. Residents are reminded to complete and return their renewal packets by June 30 to avoid coverage loss, but MDHHS will not disqualify anyone until the end of July. The department urges families to submit renewal paperwork even if they think they are no longer eligible, as some members of a household may still qualify for healthcare benefits. MDHHS aims to reach as many Michiganders as possible to ensure continued Medicaid coverage. Michigan's Medicaid beneficiaries are facing an important deadline, renewing their coverage by June 30. The Michigan Department of Health and Human Services, MDHHS, is pulling out all the stops to preserve Medicaid eligibility for residents who need to complete renewal forms. As the renewal process resumes following the COVID-19 pandemic, MDHHS is taking advantage of new flexibilities and strategies provided by the federal government. These measures aim to alleviate the impact of renewals and ensure that Michiganders can maintain their coverage. However, the department acknowledges the challenges faced by residents and has extended the deadline for returning paperwork until the end of July. MDHHS emphasizes the importance of returning renewal packets promptly to avoid coverage loss, as mandated by federal law. This change in disqualification timelines is exclusive to June renewals and provides MDHHS with additional time to implement strategies authorized by the federal government for outreach to beneficiaries. It is crucial for families to submit renewal paperwork even if they believe they no longer qualify for Medicaid. MDHHS points out that certain members of a household might be eligible for healthcare coverage, even if others are not. For instance, a child may qualify for MeChild, even if their parent is not eligible for other Medicaid programs. Similarly, some Michiganders may have income exceeding the limit for one program but could still access healthcare benefits through another. Starting this month, Medicaid and Healthy Michigan Plan beneficiaries must renew their coverage, in compliance with federal legislation, which requires states to reevaluate Medicaid eligibility. The renewal process for traditional Medicaid and the Healthy Michigan Plan will occur monthly from June 2023 to May 2024, with MDHHS sending out renewal notices 3 months in advance. MDHHS Director Elizabeth Hurdle expressed the department's commitment to ensuring that as many Michiganders as possible receive Medicaid coverage to keep their families healthy. However, there's a pressing question. Are residents returning their June renewal forms or waiting until the last minute in July? During the COVID-19 public health emergency, Congress passed the Families First Coronavirus Response Act, requiring state Medicaid agencies to maintain healthcare coverage for all medical assistance programs, even if someone's eligibility changed. As a result, more than 3 million Michiganders, including 1 million Healthy Michigan enrollees, benefited from uninterrupted Medicaid coverage without redeterminations. However, this requirement ended with the Federal Consolidated Appropriations Act of 2023, signed on December 29, 2022. MDHHS will assess a household's eligibility for all Medicaid programs, considering not only the programs in which an individual is currently enrolled but also each family member within the household. To stay informed about renewal months, all Medicaid enrollees are advised to check www.michigan.gov/mibridges. The state of Michigan remains committed to assisting residents in finding,